make sure that, oh, thank you, Spiro, for getting that recording going. So yeah, we'll do a quick little intro to make sure everybody knows each other on the team here, and then we can get going. So I'll just kind of follow my screen here. I think we've got everybody that was supposed to be in this room. Spiro, do you have that list up?
Yes.
Just give it a double check here. Yeah, I think we are. John Gardner was maybe the only one. Oh, there we go. John's here too. Hi. So yeah, we are good to go. So I'll introduce myself. I'm Nicole McDermott. I'm part of the project team, and I will help facilitate this discussion today. And so thanks for being here and for all your work on this project. And Park, I'll let you go next.
Hi, I'm Park Woodward.
Just a quick intro for the project team members who may not know you from the rest of the EMAC.
Yeah, I'm on the board of Ride Connections and worked at TriMet in the Seattle Metro in special transportation and rideshare car pools and van pools. So that's my background. I'm retired now, except for my work with Ride Connection.
Great. Thanks, Park. Abe.
Hey everybody, my name is Abe Moland, he, him. I work for the Clackamas County Public Health Division, where I'm the Health and Transportation Impact Planner there.
Thank you, Abe. John.
Good afternoon, everyone. My name is John Gardner. I direct Transit Equity, Inclusion, and Community Affairs for TriMet. My pronouns are he, him, and just looking forward to the conversation. Great.
Thank you, Kari.
Hi, everybody. Good to see you all. My name is Kari Schlosshauer. I use she, her pronouns, and I'm with the Safe Routes Partnership and excited to have this conversation.
Thanks, Kari. Fabian.
Hi, y'all. I'm Fabian or Fabian, and I work with CAUSA Oregon as their Civic Engagement and Advocacy Director.
Great. Thanks, Fabian. And
hey,
now, hi,
Sorry
Chris.
to drop in real quick on you. Did you guys start recording yet?
We did start recording. Thanks for checking. Nice. We're just doing some quick intros.
Very well.
So Stephanie, you want to go ahead? Oh, can't hear you.
Can you hear me now?
Yes, we can.
Okay. Hi, I'm Stephanie Sprague. I'm with WSP. I'm part of the NEPA team, and I am specifically working on the environmental justice technical work. It's nice to see you all.
Thanks, Stephanie. And Matt.
Hey, I'm Matt Delata. Good to see you all. I'm supporting the project with the consultant team, working most directly on sort of the technical analysis and the modeling work that is there to support what the impacts are going to be to the surrounding.
Thank you, Matt. And last but not least, Spiro.
Hey, yeah, my name's Spiro. I use he, him pronouns, and I'm on the WSP side of the team. I support Nicole through the EMAC work, and I'm also on the public engagement team.
Great. Thanks, everybody. Well, before we get started on the question, the last order of kind of intro stuff is there will be a report out after this, as Chris mentioned. So we'll need a volunteer from this group to give that report out. And so want whoever would like to volunteer for that to keep that in mind and be prepared. So any takers on that from the EMAC? Everyone feeling shy today? Should be pretty quick.
I can do it.
Okay, great. Thank you, Abe. All right. Well, I'm going to share my screen now, and we will get going on the first question, which, again, as Garrett had previously mentioned, is about the research document and kind of key takeaways from that document. So, is everybody able to see my screen? Yep. Okay, perfect. So, any reactions to or key takeaways to the research document? Anything you specifically really liked, didn't like, want to maybe find out more about?
I can go first too.
Okay.
On this, I think my initial just like overall reaction is, wow, there are a lot of connections between health and transportation, and it's interesting. It looks like tolling systems historically have not done a lot of work of explicitly connecting those two things. Like we had the great case study from San Francisco, and it looks like one of the tolling systems has reinvested some of the toll dollars into that e-bike purchasing program and education program, but there aren't a lot of systems that have really fed back into and critically looked at improving health outcomes through tolling systems. And so to me, that kind of just says that we have a big opportunity here with our work and what we set forth in policies and strategies. One gap that I saw was just the connections to mental health that transportation has, and thinking about social isolation and how not having access to a ride or being able to drive can isolate somebody. The mental health impacts of stress related to being in congestion or paying a new toll or having to pay a toll multiple times when you're cutting across town many ways, or having to reroute your trip to avoid that if you're not able to pay, and the toll that no pun intended, the toll that has on your mental health.
Right.
And then being able to connect that dot with our trauma-informed practices and how are we meaningfully, we have that little intro text in our policies and strategies, but how do we make sure that those policies and strategies that we're promoting, look at promoting empowerment, look at creating safe circumstances for people involved in toll policy and toll program development and outcomes, and provide choice for folks.
Yeah. Okay. That was all. Yeah. Great input there. Spiro, do you have access to the Jamboard there? Are you able to
Yes.
capture some of that? Okay.
Yeah, I
I see some
captured.
stuff.
I'm
Great.
breaking it down into 2 notes. 'Cause
Perfect.
there's a limit, maybe 3 notes.
Yeah,
There's a
no,
character
that's great. We can just do some quick little statements on there to make sure we capture the intent of what Abe was saying.
Okay.
We'll give you a minute to catch up there, but Kari, I see you have your hand raised, so go ahead and you can chime in next.
Thanks, Nicole. Want to make sure Spiro's got caught up before I start talking,
Yeah.
because I know it's hard to talk or listen and type at the same time. At least it's hard for me.
Yep, we are good. Thank you. And we are the
Awesome.
yellow sticky notes, in case anyone was wondering.
Okay, great. So yeah.
No, I was just going to say, if anybody sees anything else from any of the other groups too on the screen that you want to kind of reiterate, make sure you can do that, and we can kind of put a check mark or something by it too. So sorry, go ahead, Kari.
That's all right. Yeah, it's a little hard to read because it's pretty small, but
okay.
But yeah, I definitely wanted to reiterate what Abe was just saying. I agree with a lot of those elements, and I think the only thing I wanted to really add here was that my sort of reaction in reading through the document, I saw, I think it was in the case study from Florida, that found an increase in traffic volume, which is concerning from a health perspective in terms of vehicle emissions that would be impacting surrounding neighborhoods, as well as just the traffic that is impacting the surrounding neighborhoods and elsewhere. That implementing these elements leads to increased traffic volume. I think it's a key thing that is of major concern. And then in the same study, that safety was just stable. So safety, can't remember exactly what it said, but yeah, the number of fatal injury crashes did not increase while the traffic increased, which sounds good on its face, but it didn't decrease either. So I think that's a major concern. And I think that's definitely something that we are wanting to be looking at in terms of how do we address that to make sure that we are actually decreasing safety, decreasing crashes rather, increasing safety, decreasing crashes, significantly, and that, you know, it's not just remaining flat, because flat is already an unacceptable level.
Right. Okay. Yeah, that's a great point. Anyone else? Key takeaways on the research document? Okay. Yeah, I know myself, found one thing that it was really interesting, that there were not a lot of while there's strong connections between transportation and neighborhood health and safety, there's not been a lot of mitigation or things put into other projects. So that was certainly a key takeaway for me in looking through these. Well, if everybody's okay, I know we've got a lot. Oh, go ahead, Abe.
I guess I have one comment / question, I guess, that might blend us into the policy and strategy, which is
Sure.
our next quote is just,
Yep.
I feel like a lot of those those content areas, air quality and noise and safety, are overlapping with some of the NEPA mitigations that are going to be coming out. So I guess I just have questions around how do we balance policy strategies and mitigations and be cognizant of that and provide complementary feedback when we don't quite know yet, because the analysis hasn't been completed around what those actual mitigations will be for air quality and noise and safety.
Yeah, I think that's something that we will have to continue to look at as we develop more of those policy and strategy options. And then, you know, those kind of being some overarching principles that EMAC will be able to provide the recommendations on. And then once we get through the analysis and get to the point of mitigation, we'll have those recommendations to look at as well when we are addressing mitigation. So yeah, it is kind of a chicken or egg situation in a little bit, and will be something that the project team will have to continue to consider. Stephanie, Matt, anything to add there? Not to put you on the spot, but
I thought your answer was really good. It was better. It would have been better. It's better than my answer would have been, because I think it's a really good question, Abe. You know, I think it's an ongoing challenge. I've used that phrase chicken or egg a lot of times in this project. So.
Yeah. And I know I've heard Garrett say too, just in EMAC, you know, clearly articulating what your desires are and your recommendations will go a long way in helping the project team understand what they need to do to meet the expectations of EMAC too. So just something to consider. Okay. Well, nothing else on this one. I will move on to the next question just to make sure we have enough time for those policy and strategies. Everybody okay with that? Yeah. Okay. Let's see here. Sorry, I zoomed into my screen here, and there we go. Okay. So the next question is, you know, considering what you know about your communities, the research document, are the policy and strategies that Chris went over, are those right? You know, what are we missing? Are we at least at the right starting place? Not everybody all at once.
So I have a question just about that first statement, right? So the toll dedication of 1% of the toll revenues to address impacts from the diversion. So then the idea would be we'd get a list of what these impacts are later.
So so that again is some of the chicken or egg situation. You know, we may not know the full extent of impacts before EMAC is making that recommendation on a policy. But I think the idea is to consider what EMAC would like to see as an overarching policy, with understanding what you maybe assume to be impacts from tolling, some rerouting in neighborhoods, relative to neighborhood health and safety, rerouting, I think would be the biggest potential impact. So, we may not know the specifics of that, but considering there is likely to be some level of rerouting, what are some policies to address that that you would want to see? Does that make sense?
Right. And then the second one is where we move beyond what and we do a little how. Is that fair? And
Yes,
okay.
I think that's fair.
But we could also have health impacts in the first one. Just in the second one, we're being specific about who. Okay.
Yeah. And I'm going to make sure I get and Kari, I see you have your hand up. You can go ahead too. I'm just making sure I have the policies front and center on my screen as well.
Thanks. Were you done, John?
Yeah, thank you.
Okay. I sort of had a clarifying question because in this document with the initial list of neighborhoods health and safety policy strategy options, for example, it says toll exemptions, discounts, credits, or rebates. And it says public emergency response vehicles and non-emergency medical transportation services. And I was a little confused about why that didn't include transit, because we had talked about that before. And so I wanted to clarify, is that not here because it's somewhere else, or is that left off here for a different reason?
No, that's a good question. So my understanding of this, and we can clarify with Garrett to make sure my understanding is correct, is that this is a policy that's specific to neighborhood health and safety. The transit component was more specific to transit and multimodal. And so that would still, as Garrett was discussing, that some of these policies will blend together and become, maybe one policy recommendation in the end. Right now, we've kind of we're breaking them out to discuss these different topic areas. But no, it's not, it would still be there. It's just,
that's helpful. Yeah. And then they just sort of all get rolled up in the end to one thing. Exactly. That's great. That's helpful. Yep. So thank you. And then my other comment was, that I feel like I didn't see in here something that specifically talks about an exemption for low income drivers in the area. So in the neighborhood area around where the tolling is taking place. Okay. And wanted to make a comment that I think that's something that, should be included, especially for people who are low income drivers who live in that neighborhood area. And that I don't think we've really talked about this, but I do want to put in a plug for that being just an exemption, not a reimbursement, not something that folks have to pay for and then, get reimbursed for later, but that's something that would be established for low-income drivers. That would simply be an exemption that they never have to pay for.
Okay. And you said low-income drivers, it's specific to the neighborhoods around the tolling, but are you specifically focused in on those neighborhoods, or are you also speaking more broadly about low-income drivers?
Well, I mean, I would be speaking more broadly about low-income drivers, but this is specific to the neighborhood. So yeah. I'm explicitly saying within this column, this category, that people who are low income in this area should be on this list.
Got it. That makes sense. Great. Thank you. And let's just pause for a second. I just, Spiro, are you capturing some of this and just making sure? Yep. Awesome. I know you are. Just giving you a second to.
Yep. Got that. I didn't. The questions that were already clarified. I didn't, but got the comment on here. And please let me know if I need to revise any of the wording.
Okay, great. Thank you. Abe, I saw your hand up, and Park, now I see you as well. So Park, I'll let you go first. No offense, Abe. We've just heard from you a lot already.
I think it was mentioned elsewhere, but I didn't see it right in these policies. Nonprofit transportation programs. that
Okay.
don't have a fare. It's similar to they do a lot of the medical trip, also do a lot of kidney dialysis.
So nonprofit medical.
Well, and beyond medical, all sorts of life sustaining. So nonprofit agencies that are carrying people with no fare are tending to provide alternatives to people driving for needed things, from social meetings to shopping to medical trips, all that.
Okay, great. And you're thinking about exemptions for those types of drivers?
So social service agencies, nonprofit agencies that are not charging a fare.
That are not charging a fare. Okay. Yeah, great. So yeah, Spiro, I think the simple comment there is kind of exemptions for social service agencies not charging a fare. Yeah. Great. Okay, Abe, go ahead.
Yeah, a couple thoughts here. I'm probably going to muddle through trying to organize it in my brain and make words come out that make sense. One is just to kind of circle back to Kari's comment around low-income drivers, and curious around the connections between leveraging systems that already exist to identify those groups, whether it's the Medicaid system, or qualification for SNAP benefits, or some other type of system that we could leverage to identify that. And then I guess tie that into an outstanding question that I have is if the Medicaid system would in fact cover non-emergency medical transportation rides, or how that plays out in other jurisdictions, other states that have NEMT systems and tolling systems, where that cost really falls, if it falls on the Medicaid system itself, or if that's passed along to the small business owner that's the transportation provider, which could potentially cause them issues as a disincentive to provide longer regional trips, if there is an additional cost added to them, which would hurt the patient in the end.
Yeah.
So wanting to just put that question on there. I'm also curious to this, when we're talking about like using a public health approach to some of the strategy development, I think it's really the community knows best on what they need to promote their own health and empowerment. And so it raises for me, circling back to that policy option around community-based organizations receiving dollars and identifying projects that align with the 4 categories that are outlined around access to human needs, neighborhood livability, safety, and environmental quality. And I guess this is a point that I'm curious around the delineations between when we're talking about the 205 tolling project and needing to identify CBOs specific to that corridor versus regional groups and the regional tolling system, and being able to find groups that are able to speak to that different set of needs and burdens that are created by the toll system. So I guess I just want to put that on there, so that it's that we're talking about 2 different systems throughout these, and needing flexibility and adaptation for the different toll models that we're looking at.
So yeah, so considering, the service areas of those would be different. So really looking at the differences between I-205 and the regional project related to community organizations. Yeah, and I think just a simple statement on here too is, community knows best. I think kind of captures some of that as well. And just to your point about 205 versus regional, and Stephanie, I see, I'll let you go next, is, right now we are focusing on 205 because it's what we are the furthest along on. It's what we know the most, about, but a lot of the information that EMAC provides specifically related to 205 from a, where do we look, what kind of data do we tap into, those sorts of things we will use on the regional too. The data may be different, but how we obtain it and lessons learned from 205, we will use on the regional project too. So Stephanie, yeah, go ahead.
Yeah, I wanted to ask Carrie to clarify a little bit on her comment about the exemption for low-income drivers in areas surrounding the toll. So I'm just wanting to, I mean, we will certainly be analyzing, you know, the effect of the toll, the economic impact of the toll on low-income drivers that will be paying the toll because they're traveling through the study area, which would include, my understanding is that you're referencing people who live in neighborhoods around the toll facility that would be traveling on the toll facility. Is that correct, Carrie?
Kari, yeah.
Kari, sorry.
Yes, I mean, it's more, you know, again, sort of related to my other comment where I'm just not seeing it explicitly listed here, and so wanting to bring that up. So I know that there's a larger conversation about exemptions across the board, which clearly would apply here, but because I don't see it here, or maybe I missed it, but I didn't see it in the document when I was reviewing it. I wanted to make sure that because this is the sort of the piece that's talking about neighborhood impacts, that it is clear that for people who live in the neighborhood that they would be exempt from paying these tolls. Does that clarify?
Yeah, I mean, obviously we still don't know what the toll policy is going to look like, but from a NEPA standpoint, we certainly will be looking at both low-income drivers in the areas where rerouting would occur, and also drivers who are traveling through and paying the toll that may not live in neighborhoods where rerouting has occurred. They may live further afield. So I just wanted to, you know, just state that both of those will be considered in the NEPA document.
Okay.
Yeah, and I think just to add on to that, I think Kari, to your earlier point, you know, you were focusing in on the neighborhood specifically because that's kind of what we're talking about right now too, is the neighborhood. So so I think that's understood. And I would imagine when we get into the affordability piece would that be August and September is when we will talk about affordability. We will really be talking a lot more broadly too about potential low income exemptions and things like that. So John, Fabian, any thoughts on the policy and strategies?
I think that, you know, I think what I was reading is good. I think one of the policy options that I think is important to highlight is working with the CBOs, and not just only in those regions, right? I think because there's a lot of different people, in this case, I think immigrants, right, who work and have to use those highways as well and don't live in that area, may live in like Salem or in different rural areas. And so, yeah, I think that, you know, identifying which community-based organizations will be able to work on these projects is going to be very key. Not always are they going to have to be in those areas, but they could be. But yeah, I'm interested to see more about like what are these projects that or programs that we're going to need to work on. And obviously, like Abe and others have mentioned, it's going to have to be like a lot of listening on what the community needs, and what problems will come from tolling, right? And I think, you know, there's the economic side, the health side, and other impacts that will happen.
Great, thank you. Yeah, and I think we can kind of get back to some of that CBO conversation and with our discussion of the next question as well, which is, you know, about the social and community resources and, you know, how we identify those and what categories we use and things like that too. So I just made note of that. Abe, I see you've got your hand up too.
Yeah, just one more quick thing on strategies. I'm curious if there's ways to add more specificity around air quality and air quality monitoring, both as it relates to the highway and areas of existing diversion and possible future diversion, as a strategy to kind of monitor performance and health outcomes. And yeah, I think that's about all on the pepper in there.
Great, yeah. So yeah, more specificity around air quality monitoring, I think is the simple note there, Spiro. Thanks, Abe. Any,
The only thing I was gonna say, Nicole, sorry, I
Yeah.
can't figure out my hand raising button.
no,
Was,
it's
I
okay.
mean, you know, the more I looked at the strategies and the policy feels very early, like you said, chicken and egg. So it just makes me really hungry for the how. And I'm glad that we identified community-based organizations for healthcare, but I think just even whether it's connecting people to more transit options, there's a role for them to play across multiple issues or opportunities. So I'm looking forward to that next iteration, but I think this is generally a good start. And I
Okay.
do think it captured a lot of the known conversation, so.
Yeah, great. So again, yeah, Spiro, I think if you just note, need to identify the how, as a simple comment there, and then connections to transit agencies so we're just reminded, obviously, to continue to make that connections with neighborhood health and safety, not just when we're talking about transit and multimodal.
Got it.
Thank you.
Yep.
Anything else before? I'm sure I know it is probably kind of hard. I don't think I can make this any larger, probably hard for some of you to see what else is on the screen here, but if you can see anything popping up from any of these other groups, any discussion points you want to make there, feel free. I see some similar comments as well. So
I guess one thing I'll lift up is just the connection to reducing climate change drivers. I think this is our bucket that we have a strong opportunity to do that in, since we know that climate change is impacting health through wildfire smoke and increasingly hot days, which are sending more people to the ER. So I think there's some co-benefits, and it's an opportunity to multi-solve.
Yep. Yeah, connection to reducing climate change. Yeah, that's a great note. Okay. All right. If no one else has anything here, we can move on to the third question. Okay. So this, again, as Garrett and Chris had previously mentioned, really related to the performance measures document. And so if you have that document handy, and we understand from the previous workshops, that is a very, very meaty document and kind of difficult to digest and always discuss in this setting too. And so we really kind of wanted to, we're open to you providing feedback, of course, on any element of the performance measures document that you would like, but we wanted to kind of focus this conversation on the social resources maps and really begin to get some more input on, some specifics on those maps, and then also just more broadly, maybe categories of resources, data sources to obtain some of those resources, that sort of stuff. So if we can start there, and then if you've had a chance to look at the performance measure document in more detail and you want to provide any other detailed feedback, I think we'll have time for that too. And you can, of course, always email comments to the project team too. So I can pull up the social resources map or the categories listed in the performance measure document if people don't have it in front of them and they need to. Would that be helpful? Yeah, John's saying yes. Okay. Give me just a second here. I'll stop sharing and share a new document. I think maybe we can start with just the categories. And All right. Can everybody see that? Okay. So this is where we've started on the social and community resource maps. We're identifying places of worship, community centers, hospitals, libraries, nursing homes, parks, schools, and urgent care facilities. You heard some of the feedback from the NEPA Scuba team needing to get into some more specifics about, dialysis centers and other community kind of medical health facilities that are maybe more important than even hospitals to consider. And then also some nuances around schools and demographics associated with the schools for Title I and free and reduced lunch programs and things like that. So yeah, I'll stop talking and let someone else jump in.
I think these are great. Something that came to mind were looking at like apartments, especially low income apartments where there's larger families. I think those can be another area that we could include.
That's great. Yeah, and that was something we heard affordable housing from the Scuba team too. But I like your focus on that serve families too, because I think that is a distinction. So.
Was there a conversation, maybe around like food sources and just, just sort of not really quality of life, but I know that the farther you go in different parts of our region, there's, a little bit of food deserts, and I'm thinking more healthy grocery store options or that sort of thing. But
There was a conversation around that. So yes, I did. The NEPA Scuba team mentioned that as well, that including grocery stores, but then also other food related businesses or services, food pantries, maybe Meals on Wheels sites and things like that. So yeah, that's great to reiterate that point though. Kari, I see you've got your hand up.
Thanks. Yeah, I had a similar comment around that John had around grocery stores and also things like pharmacies and other destinations, which I think may have come up in the Scuba team, but just wanted to reiterate that. And then I was also wondering about whether it's possible to look at where there may be other sources of emissions, air quality emissions, or impacts, for example, from industry or maybe long-term construction that would exacerbate air quality issues, or contribute to those issues that would also be coming from the roadways and the vehicles. So thinking about that, and then I guess my final point was just wanting to make sure that when we're looking at accessibility to jobs or whatever else by different modes, that we are weighting and prioritizing improving non-auto travel. I think making sure that that's it's not just all modes are equal, but that is something that we're looking at specifically improving and prioritizing improving non-automobile travel, which is something I don't always see happening. Thanks.
Yeah, that's great. That's I think we've heard that point before, but not specifically related to this. So yeah, accessibility to jobs and a prioritization of non-automobile trips or facilities rather. And then also to your point about looking at other potential air quality, generators or pollutant generators that might impact air quality. Stephanie might be able to speak to this a little bit more, but I think within the air quality analysis for NEPA, that those other other potential sources are looked at as well. I mean, specifically within a cumulative analysis, that would be considered. So Stephanie, I don't know if you want to add anything there.
Well, I'm not an air quality expert, so I'm not going to
I
speak
know.
to that. But yes, I was going to mention the cumulative impact analysis, that is likely where that would be considered.
Yeah. Great. Abe, go ahead.
Yeah, I would just kind of add on to Kari's comment and emphasize something that I think I saw in the Google, the Jamboard around specifically small business and access to small businesses and mapping those. I know Clackamas County is looking at some anti-displacement efforts, and smaller businesses are being pushed out in more central areas in the county. So wanting to think about how tolling could potentially impact that. And then I'm curious too, just kind of from a mapping perspective, looking at where diversion goes from just kind of a zoning perspective. Is it more typically going through residential zoning or commercial zoning, and what that could tell us around impacts to the community?
Yeah, that's a good point. Matt, I'll put you on the spot there. If you have any input on that, or know anything at this point as far as where you typically see the rerouting?
Yeah, not specifically. I think it's a good question. I don't have a specific answer. It's, you know, where the rerouting impacts are going to be will likely be a mix of land uses, and some of it will be residential and some of it will be commercial. So I don't know that we have a sense for that. I mean, it tends to be on like the bigger arterial roads, right? Not through a neighborhood per se, but some of those bigger arterials certainly have housing alongside them, right? So I don't have a clear answer for that, other than it's likely to be a mix.
Great. That's just important to note down then, and, you know, as far as our analysis goes, something to consider. I'll bring back up the Jamboard quickly, because I think we're going to probably get pulled out of the room again here soon. So Spiro, I've made some notes to, it looks like you've captured a lot of what we've been discussing here.
Yeah, let me know if there's anything I should revise. I've just been on mute, but yep, definitely been capturing the points.
Yeah.
So feel free, anybody, to jump in if I butcher what somebody said in this space during my report out. I welcome the support, and I did my best to try to take some of my own notes to help me remember, but definitely jump in if I miss something key.
Thanks, Abe. And I will be sharing the Jamboard screen, so you will have the Jamboards to kind of look to as well. Yeah.